Thanks for coming, everybody, to this webinar. With this webinar, we're going to kick off our partnership with RareX, which is an organization you might have heard about. I recently did a panel on data sharing with the CEO of RareX, Charlene, and two other partners of SRF, Devin from Citizen and Jake from Beacon Biosignal. So if you haven't watched that, syngap.fund/data, it's a very good high level. And now we're going to double click in this webinar on RareX, which is a very exciting organization that I will let Megan and Tom tell you about. But it's my privilege today to introduce you to Tom Hume, who is the head of marketing and communications for RareX, and Megan O'Boyle, who is, do you have a title, Megan? I mean, you're just Megan O'Boyle. Like you're
Shannon's mom and also patient engagement lead.
Shannon's mom and patient engagement lead. And Shannon has Phelan-McDermott syndrome. Is that right?
Correct. Yes.
So Megan O'Boyle has been at this rare disease game longer than any of us. She is one of the greats. If there was a deck of cards of rare disease leaders, she would be one of the royals. And we're really lucky to spend time with her. So this is a very exciting time to be kicking this off. I've been thinking about this for some time, and I'll hand it over to Megan and Tom to tell us about RareX.
Great, Tom, go ahead.
Yeah, sure. Just a quick introduction. My name is Tom Hume. I head up marketing for RareX. Also no stranger to rare disease at all. My middle son has juvenile dermatomyositis. It's in the autoimmune space. And we started when he was about 4 years old, we started the Cure JM Foundation to help find research and cures for juvenile dermatomyositis. So very familiar with a lot of your journeys and very happy to be working with RareX and helping you out.
Hello, everybody, and thank you for setting aside some time. I know you guys have lots going on in your lives. My name is Megan O'Boyle, and I do have a daughter named Shannon who has Phelan-McDermott syndrome, a deletion on the 22nd chromosome. Like so many syndromes, Phelan-McDermott syndrome is a genetic cause of autism, epilepsy, sensory issues. She's non-speaking. She doesn't sleep well. She has GI issues, and the symptoms go on. Unlike the group on this call, I was not one to start a foundation or even really get involved in research for her first 10 years. I was pretty focused on getting through the day. But when our organization decided that it was imperative to start collecting data, I worked with some other families to start a registry, and that was in 2010. We did a great job with what we knew, and we didn't know what we didn't know. And my job going forward today and working at RareX is to share my learnings and mistakes and all the things that we wish we'd known back when we did our first data collection. So with that, I will start sharing slides. I just want to congratulate your community today. It is incredible to me what you all have accomplished in such a short period of time. Our community was very strong and organized, but it took 20 years before data collection became a priority. And it took 10 years of lessons to get it to where it is now. So, kudos to you guys for, just the incredible work and speed at which you all are moving.
Hey, Megan, real quick, I think you pulled up, you got to pull up Syngap one. Sorry about that.
Sorry about that, guys. Give me just 1 minute.
No, it's exciting. This is a feature, not a bug, right? We're doing this alongside some other groups, so there'll be some cross-group data available.
Excellent spin. Thank you.
Well, spinning is part of the job. And I don't think it's spin, I think it's true.
Let's try. When I was doing the slides, there's an incredible amount of collaboration that you all have already with so many of these groups. And it speaks to the fact that these are all groups that are so forward thinking, despite how young your organizations and diseases are. Okay. So just to get started, RareX is not the important entity here. Your organization, your community, Syngap One is what's important. But RareX is a nonprofit that was created to remove the barriers of data collection for researchers and industry, and remove the burdens of collecting data for organizations like yours. There's so much that goes into knowing what to collect, where to put it, how to govern it, keep it safe. And frankly, your organizations need to be raising money and taking care of their community and doing other things for research. So RareX was created out of a great need. We're a platform that collects data, which we'll talk about. We will be able to connect data, which is very exciting in your community, especially because you have so many great projects going on. And most importantly, get the data out the door to those who need it, whether it's researchers, industry, and hopefully someday regulators like FDA and EMA. We do not own this data. The participants do. We do not sell it, not even to biotechs or pharmaceutical companies, and we don't do any research or analysis with it. We are just a conduit. In case you're wondering, what's the big deal about data collection and, why does it seem, are we complicating it? The fact is, and your organization did a lot of due diligence before making the decision to go with RareX. In the rare disease space, data may exist, but it may be in a silo. It may be with one researcher that no longer has funding, or maybe at one institution. And although that's important data, it may just not get into as many hands. The other issue is that the data has been collected, but it wasn't collected in a structured or standardized way. And it's not very useful or valuable to the people that need it. And we'll talk a little bit about that today. Or for so many young diseases, there is no data collection at all. So this busy slide from top to bottom is the second class of early adopters to RareX. And you'll see some conditions you may recognize, and like FOXP1 or STXBP1. These are other neurological disorders that have chosen RareX, and your patient organizations are up here at the top, and you'll go through a community page to reach RareX, and we'll show you that as well. Once you get into RareX, you will have the usual consents and such, but then you'll have surveys based on symptoms that you report. And that's going to be an iterative experience. We will be adding surveys over time because RareX is being built to serve the needs of all 10,000 plus rare diseases. So we will need to make sure that we cover all of the systems of the human body. And at the bottom is what, as I said, as important as the patients are the researchers that are trying to find solutions. And it's very exciting how RareX is getting the data out the door, rather than researchers who traditionally have to go to each community and ask for data. RareX has one portal where researchers can go in and provide their credentials and can query data across RareX. And that's incredibly important in the rare disease space. It also allows researchers to stumble across data of diseases that they may have never heard of, but actually may fit their area of interest. Governance is a big, heavy weight that we did not think that any of the organizations needed to have to carry. So RareX is taking care of the governance. Governance is how data is collected, how it's stored, and how it goes out the door. And with that is everything from informed consents and data sharing preferences to all of that security and privacy that we all know is so important around our data. So as I said, this was not a decision taken lightly. As always, your organization has done great due diligence to decide how and where to collect data. One of the reasons that we were an optimal choice is that there's no fee to your organization for this. So that allows them to use their much hard-raised funds in other research endeavors. There's also no fee to researchers or industry, which levels the playing field. I touched upon structured and standardized data. Your organization won't be bringing surveys to us. We will be providing surveys that have been researched and proven to be the best known survey or instrument for that particular symptom. Again, patient owned and managed, which I'll explain in a few moments. We already talked about governance. And again, this streamlining of getting researchers in to see the data and analyze it up in the cloud without having to jump through hoops at several different doorways is really huge. And all of this is in hopes to speed drug development. I have a feeling I have a window into your lives. I understand that you are probably sleep deprived and you're lucky if you get a shower 2 days in a row, and that you really have very little time for yourself, much less more surveys. So we want to make sure that you understand this is not just a favor you're doing for the research world. This is something that you will benefit from, your family, your doctors, possibly your IEP. You will have access to summarized data. So you will see, once we've collected enough data, how your family member may compare to others with the same diagnosis or differ. You will also, if you choose to want to be contacted for future studies or clinical trials, this will be a way that those researchers that are doing queries on data will identify participants that might be the best participants for their studies. Again, more eyes on the data, which is what you want. I mean, you know, we don't want just a handful of researchers that know about our diseases working on them. We want researchers from all over the world that are interested in all sorts of different systems looking at us. The ability to connect with your patient organizations in your space if you want to. You'll have the opportunity to share your name and email if you choose. And also updating your symptoms at any time. This is true of any online data collection, but it's not true of the traditional clinical studies. For instance, my daughter is in a natural history study at NIH, and it's phenomenal, and it's funded for 5 years. And once a year we walk in the door and we answer assessments and we have labs done. But that's one day, and her mood, her abilities, the sleep she got the night before, the traffic we sat in on the way to that appointment, all will be reflected in just the data for that day. That's what will be published on her. And 2 days later, she may come down with a new symptom, and it'll be another year before I can report that to the study. So the ability to go in anytime you want and update symptoms, progress, or regression is really important. That also means that the researchers that are looking at the data are seeing every timestamp, every time things have gotten better or worse. And that's where the word history, natural history, comes from, is that you see the progression of a disease over time. So you will get reminders from us that if you haven't been in the last year, that it's time to come back. And I have a feeling you'll get reminders from your organization as well. I hope this is motivation for you to try and carve some time to get enrolled as soon as possible. What do you need to get enrolled? An email, a password. You do not need a lot of medical records, but frankly, you guys are better placed for having access to medical records than most any group I know because of your relationship with Citizen. You do not need to have a detailed family history and remember which side of your maternal family had what symptoms. You don't need a lot of time. The amount of time that all the surveys will take will be dependent on how many symptoms your family member may experience, but this doesn't have to be done on sitting. I really want to highlight that we recommend Google Chrome and Apple Safari. And at this time, we're not recommending mobile devices, although you can do this on a smartphone, an iPad, or a tablet. In our testing, we just didn't feel like it was optimal. So while we're working on that, we'd ask that you, it's better to use a laptop or a computer. So this is just what your journey is going to look like. Like anything else, you're going to set up an account, which involves, terms and consent. And then you will answer data sharing, which I'll go through. And then, as they say, you're off to the races. You'll start answering surveys, and depending on the answer to one question, you may have other additional surveys show up in your dashboard. So this is the community page that Tom has built for you all. You'll see up in the left-hand corner is Syngap 1, and I'll take you to this in a few minutes. This, as you scroll down, will give you more information about why this is important, how to do it. Then there's some FAQ at the bottom. This page can actually be translated. But once you hit this Get Started button, which is how you enroll in the Syngap 1 data collection program, then it will only be in English for now. This is a global data collection. It will not remain in English only. Spanish and one other translation will be added at the end of this year. And as we confirm that we are meeting the data regulations in other countries, we will continue to add translations. At this time, anybody in the world can enroll as long as they can read English. Once you hit that Get Started button, you are going to be at, like all of our other apps, privacy policies and terms of use. You can review this, but you're going to have to roll down all the way to the bottom, and you'll have two choices. I agree, start my enrollment, or I've already have an account. Obviously, for your group, it's going to be the one on the left. I agree, and I'm going to start my enrollment. So this is the request access page. We need some primary information from you before you set up your account. And so it's your name, not your family members, email, phone number, date of birth. Read through these carefully. Some of these you can click more than one. In other words, a participant can be a patient as well as a caregiver, or a person who has lost a loved one to this disease. So once you fill that out, like with all the other apps, you now get an email. The subject line will say account creation notice, and it will explain about setting up a password. And that will come from a RareX email address. I don't have to walk you through this. I'm sure you all understand how you set up and change passwords, but there is plenty of guidance, and we can also provide a quick start guide to you. And this is where you're going to get logged in. We have another terms of use. So Matrix is the technology that RareX is sitting on. So they are holding the data and providing the technology. So again, you'll have to review it and hit next there. And now you're in the consent. And I know you all have seen tons of consents. Every time our kids go into the hospital, we have to consent to have something done. They're generally 5 to 25 pages written by lawyers, and we generally flip to the back page and sign them. I highly encourage you to feel great about what's going on with your data. So we wanted to make this user-friendly. We've put this consent in question and answer form, and we have short answers and long answers. For those who are more curious, the lawyers amongst us, you can click on the long answers. You're going to get to the last page of the last 2 pages of the consent. And up here, we need to know what your role is. And again, you can have multiple roles. And then in these 2 questions, I would highly recommend yes. This says that you want to continue to receive surveys. And the second one says that you want to hear if you qualify for a trial or a study. This is not a commitment that you have to participate in it. Just means you'll get an email saying, hey, if you're interested, please contact this researcher about this study. So again, I checked yes. The last page is going to ask for your legal name. Even though nobody's ever called you William and you've gone by Billy your whole life, go ahead with your legal given name. This is going to be creating a code going forward. So now you've set up yourself as a caregiver, and your name is up in the left-hand corner, and you're going to fill out your demographics. I'm going to give you a heads up here. Our programming team is diligently working to solve this problem, but sometimes our computers outsmart us. And if your browser has autofill, when you put in your last name, it may change your first name depending on what your autofill uses. So you just need to double check that that's accurate. And the state field does not want your state spelled out. It would like your state abbreviation. These are the regular demographic questions you get, and we tried to make this as international friendly as possible. This ethnicity is actually from the World Health Organization. So we followed the best possible standards. There is an opportunity to say prefer not to answer. I want to point out, we get these questions about household income all the time. And it always made me feel a little nervous, like someone was going to look at this and maybe hit me up for a donation. This information is for socioeconomic research. This is how they determine whether someone's socioeconomic situation might be a delay in diagnosis, a delay in treatment, and possibly an increase in mortality. You do not have to answer these questions again, but I just wanted to let you know this data is not being used by your organization or RareX. You'll see here where it says rare disease, there's a drop down. If you don't see your disease, start to type it and it will pop up. On the left, it says clinician. When you hover over this, it will say, do not fill this out unless you have a clinician accessing your data. Right now, none of you have a clinician accessing your data, so you're going to leave that blank. But that will be an exciting time where you will be able to allow some of your medical caregivers to have temporary or long-term access to this data. This is the exciting part. How do you own this data? You're managing it, not your organization, not RareX, you are. So you can share your data as broadly as you want, or you can restrict who sees your data. And most importantly, you can change your mind and change your decisions. So the first screen asks, you have one choice, either choose one or two. The system will not let you choose both, and it will not let you go forward without choosing one. The first says, any researcher doing any kind of research can see my de-identified data. And I just want to emphasize this. No researchers or pharmaceutical companies will ever see identified data. Your own organizations will not see identified data unless you give permission just for your name and email, and that's it. The second answer here is, I want to share my data with anyone doing health, medical, or biomedical research, which for the most part is who's looking into our data. Thus far, most people have checked number one, but this is your decision. You can check either. The second option, you can check one, both, or neither. I did not check either of these boxes because I personally want to share my child's data very broadly. If you don't want your data shared with biotechs or pharmaceutical companies, you would check this first box saying research solely for non-commercial purposes. If you want only researchers whose own institution has reviewed their research and it has the stamp of their IRB, their Institutional Review Board, you can check that box. Again, that would preclude researchers that are doing hypothesis, generation and just kind of looking at data from different angles from being able to see the data. The next few questions are really for us to be able to let your organizations know what you all are willing to share in the future, or what you have somewhere already. So do you have a sample somewhere? If so, do you know where it is? Are you interested in providing biological samples? This next question, your community has asked and answered, but we're asking everybody, are you interested in having your medical records connected to RareX? And in other communities, we might go to them and say, hey, 90% of your community wants their medical records connected. Since you all are way ahead of the world and have already started a project with Citizen, we already know that you're interested in having your medical records connected. And this last question, and I'll give you a cheat sheet for this answer, is what other studies have you been in? And the reason we're asking that is because we want your data to go as many places as possible, and we want your data to be connected to as many previous places, like the connection with Citizen. And so, for instance, if a lot of you had, participated in a study, we may come to your organization and say, let's go back to that source, that original study, and see if we can connect the data. So not surprisingly, you guys are, ahead of many groups with the number of studies you're doing. And I highly suggest that if you've not gone to the research part of your website, that you go. Some of you may be involved in some or all of these. And I believe Simon's is on there, should have been on there as well. This is the question where it says, do you want to share your contact information? We're changing that so it's very clear. This is not your home address. This is not your medical answers. This is just, do you want to share your name and email with other organizations in this disease area? I'm guessing you've already done that, or because you know about this webinar. This other question is a little long, but don't skip it because it's really important. Essentially, you're saying, I'm okay with having my de-identified data as part of a summary dashboard, like that it would be part of a statistic of symptoms in Syngap 1, or it may be part of a statistic in all of the diseases that are part of RareX that have a certain symptom. So again, we're talking about de-identified data. So now you've decided how your data is going to be shared. Now you need to add your family member. So you're going to need to go up here and say add patient. And if you get through this and then you leave and you come back a couple of days later and you can't remember, am I answering the questions for me, or am I answering my questions for my child? You can always look underneath, it will say caregiver or patient. If you have multiple people in your family that have this condition, you can have multiple patients. You just have to add each time. Every participant that you enroll needs a consent. So if there's a caregiver and a child, there's going to be 2 consents. And the reason is, right now the surveys are about the person with the condition, but we are going to have caregiver surveys, quality of life and other things. So we can't just consent for collecting data on your family member. We're consenting on collecting your contact data and your future data. So again, you hit new patient, and then you're going to go through the fields that you went through for yourself. Again, watch for that autofill. When I put in my last name, it changed my daughter's name back to mine, so I had to change it back to my daughter's name. We hope that will be fixed very soon, if not already. So this is the dashboard. And this is going to show you what new surveys you have. And right now, all your surveys are new, and which ones you've completed. So if you come back in a couple months and you can't remember what you answered, this will tell you. Once you answer the health and development survey, based on the number of yeses, yes, I have this symptom, additional surveys will be added to this dashboard. If there's a symptom that we're not currently asking about, but 6 months from now, we have a great survey for that symptom, you will be notified to say, log back in, we have a new survey that's applicable to you. So this is an example of the first survey, which is very, very general questions. Do you have brain issues? Do you have eye and vision issues? Do you have sleeping issues? Don't be disappointed that this doesn't get into like super detail. That will come later. Every question is yes, no, or unsure. You have to answer all the questions because incomplete data, skipped questions provide to researchers what's called dirty data. So we require that all questions are answered. This is just an example of the first question, which is, has a participant had issues with brain or nervous system? And then it gives examples. We all will say yes to that. Again, very general, and it goes through all the systems of the body. So again, this is the dashboard of what's completed. You can view or edit. And here's down here, based on your answers to that first survey, you now have level 2 surveys. So this participant said, yes, there were behavior issues. Yes, there were vision issues. And yes, there were growth issues. So they will now have additional surveys. We have filled out how many minutes roughly these surveys might take, because you may only have 15 minutes today. So you can pick the ones that you can complete. If you don't complete it, it's okay. It will say in progress when you come back into the system. This is an example of a level 2. So if you said yes to eye issues, then you would have this survey in your dashboard. And when you go into it, again, you have a yes, no, or unsure. If you say no, then you just go to the next question. If you say yes, then it's going to ask you 2 more questions. Symptoms, age, the symptoms appear, and when the diagnosis was made. At the end of every survey, there is a free text area. This gives you the ability to write in what we did not ask. Please don't add your child's name. We do not need any identifiers, and if you do, we will have to go in and manually remove it, because that, again, would be dirty data. We don't want anybody to accidentally be identified. There is a quality of life survey, and it is one of the best, which is why we chose it. But as you all may know, for some of us, there aren't really appropriate surveys that are applicable to our family member. For instance, in the past 7 days, the question may be, was my child worried? And my child doesn't speak, so I don't know if she was worried. So there is an answer that you can choose that says unable to answer because of my child's condition or communication skills. RareX is working by collecting this data. We will then be able to say, X% of people were unable to answer this survey. That means a better survey needs to be created, and that will hopefully lead to the improvement of assessments for our communities going forward. Okay, so you guys have a lot of research going on. How is this different? And it's different in several ways, but it's not to replace or compete with any of your other projects. It is meant to be complementary. This isn't being done at one specific institution and under one funding grant. This is a long-term, broad-based data collection that will be available to researchers around the world. It will allow these researchers to look across diseases, because everybody answering questions on seizures are answering the same question regardless of their diagnosis. This also allows us to return aggregate data to you, so you get to see, how your answer compared to, everybody else with this condition. And a lot of researchers are not allowed to release data until a certain period of time or until they have published. And, for me, that was always frustrating. I spent an hour filling out a survey and I don't hear about anything unless they publish it 5 years from now. These surveys are focused on drug development. We are not asking questions out of curiosity, or some researchers are really curious about something that they see a trend in, but it may not be related to drug development. We are focusing specifically on what is needed by industry researchers and eventually FDA and other regulators to get drugs developed and approved. Again, this is not in place of what you've done, and this doesn't check all your boxes in the future. This is complementary. Again, you've got lots of great things going on already. I'm going to stop sharing here. And I don't know if the questions are in the chat or if people want to raise their hand. I am going to share one more thing. So Tom has created your community page, which we also call the front door. And a link will be provided, if not in the chat.
Sorry, that's
oh my goodness, I am just.
I put it in.
No, I know what's going on. Charlene paid Megan to do this just to rib me. This is just Charlene having fun with me.
I have to say, I'm coming off 2 weeks of COVID, but this could have happened pre-COVID.
Actually, can you pull it up? I got it.
Yeah, Tom's going to take it. This is, thank goodness for Tom. He's going to show you the community page. And again, that can be translated.
So this is the your community page. Just some quick overview of why somebody would even want to be coming to this and doing it. We cover a little bit of why participate. Obviously, these are the buttons to get into it. You'll be doing get started at a later time. And you'll have the link once you log into the BCP, but if you forget what that link was, you can always hit the login to come back in too. And a little explanation of how it all works, easy as 1, 2, 3, 4. And then this is where we have a Q&A that just kind of toggles down. So if you have deeper questions, hopefully we've covered it in here too. So yeah, so that's the community page.
So before I jump in, Corey or Lauren, any questions you guys have or things you want to call out?
I don't. I think you did a great job of addressing all the concerns, especially, I know there's a lot of parents that do have concerns with privacy issues, and they want to make sure they feel like they are in total control of their child's data. And I feel like you guys do a really good job of addressing all the concerns and making it very easy to check the boxes on what they do want to share and what they don't want to share, and have the ability to go in later and change your mind is wonderful. So great job on that.
And we were very transparent. We spent almost a year on the consent with a privacy lawyer. And, you know, my concern with consents always are, if they're too long, then people just scroll to the bottom and approve, and then they're no longer informed. And that's fine with iTunes, but it's not appropriate for your medical information. So we really went to great strides to put in plain language, where is it going to be, who's paying for it, what's it going to be used for, and where can it be used. And one of the things that was novel about what we're doing is we don't want to trap your data. We want this data to go in as many places as it can, that is appropriate, that it's needed in the future. We don't know who's going to be studying this 5 years from now, but you took the time to give this data. It should go in as many places as possible. Again, always de-identified. So, you know, I urge you, if you have concerns about privacy, that there are specific questions that are addressed that in the consent.
We have a couple of questions popping up in chat. One is, this seems like such a logical and overdue approach. Is there anyone else trying to fill this void, standardizing early data collection as opposed to what Citizen is doing? I mean, I think we are pretty unique. Again, we are a nonprofit, so we're also organization agnostic.
The traditional model is researchers collect data, and sometimes they call it a registry, and they decide what questions they're going to ask. And some use standardized and some don't. When organizations like ours collect data, we always thought we're rare, so our questions need to be specific to our condition. And I was one of, you know, several parents in 2010 that went to all of our researchers and said, what questions should we ask our families? Some got pulled from standard surveys, good or bad. Some were made up, and they were very Phelan-McDermott syndrome specific. The problem with this was that they didn't necessarily yield good data. Having a question and an answer is a science and an art, and people that are called survey methodologists should be involved in reviewing how those surveys are created. And you can have brilliant researchers that know everything there is to know about your condition, but they're not survey methodologists.
Yeah.
So standardized questions have been vetted, have been validated, and they map to codes that researchers are familiar with.
Yeah, I just want to jump in. I want to make a high level point, which is Megan alluded to the fact that we've been doing diligence on RareX for a while. I have been bugging RareX and asking them hard questions for years. I am not exaggerating, for years. And you're right, Stella, this does make sense and it is overdue, but you have to remember, those of us in this little bubble, we're in a tiny, we're together with Rare as many, but historically we're not united, right? We're all these little silos and we're easily ignored and failed by the existing systems. So this is long overdue, this is late, but it does make sense and we do desperately need it. And I want to point out what Meg, you know, just tease on a few things. Megan's been working with a privacy lawyer for a year on this, right? Point out that I'll say the same thing about Citizen. One of the smartest things about Citizen is the very smart use of consents to allow for flexibility so as not to subjugate families to more data collection later, right? There's a technology platform. Your next question is, who is Matrix? Matrix is a technology vendor, and look up Jason Colquitt. He's been in the industry for a while. I will point out that he has employed there's a Syngap dad who works at Matrix on this stuff. We've got our people everywhere. But, so if you want to do diligence, call Dennis. He can tell you about Jason. Matrix is legit. And the point I'm trying to make here is the Syngap Research Fund says no to a lot of things. There's a lot of ways people will come to us and get access to our families and abuse your time for very little return. And we say, come back when you have a better idea. But then there's things like Citizen and RareX, which makes sense and give us access to stuff we wouldn't have the time or the money to build. I'm not going to pay a privacy lawyer for a year to build a platform. I'm not going to beg Jason to give me a deal on some boiled down rinky-dink platform. I'm not going to ask Corey and Lauren in their spare time to make up more questionnaires. Why would I waste the time when Megan and Tom and the entire paid salaried team at RareX has done it better? So kudos to RareX for building this, and a reminder to the community that if we bring you something, we've vetted it. And I think that our time and our patience are so precious, we should only deal with people who are professional, have thought about it, and are committed to doing it right. And I put Citizen in that box, and I put RareX in that box. And I encourage our community to do Citizen and collect your medical records, and to do this and to answer these questionnaires. And I remember, look at all those other genes at the top of this. This isn't something Mike decided was a good idea. It's something the whole board we've debated this ad nauseum. And STXBP1 is doing it, SLC6A1 is doing it, FOXP1. There's so many other rare groups who are here. And by the way, there's even more rare groups who are on a waiting list. So in spite of my obnoxious pestering, they let us in. And we should be grateful. So I just want to emphasize, like, this is a great opportunity. It does make sense. And I realize it's one more thing to do and one more questionnaire and more emails, and I can barely delete emails in my inbox fast enough. But hopefully it's a tool that we will benefit from. Sorry, Megan.
Yes, I think that I appreciate all of that. And I also want to point out that going back to one of my first slides, we are a nonprofit, which gives us incredible flexibility. We can partner with Citizen, we can partner with the Broad Institute, that incredible research portal that I keep bragging about. It is a federated data access and analysis portal. This is technology that was built at the Broad, which is a nonprofit through Harvard and MIT, and it is being used by huge international studies already. This isn't something that we just built, from scratch. This is being used, and it is also, safe, secure, and meets, it's built to meet international data regulation, which is really hard to do nowadays. We don't have a partner. We're not just having one technology, which would, might be Matrix, or one partner like Citizen. We have the ability to partner with all sorts of stakeholders that share our mission of getting data out, high quality data out. That includes, industry partners if they share our mission as well. Tom, was there?
A couple comments in chat, just a reinforcement of really wanting us to get to Spanish, and we're, the goal is year end. Yeah, I don't think there are any other questions.
So translation has a couple of angles here. One, it's not just a matter of translating it to another language and then back to English to make sure it's right. Yes, there's that. First, we have to make sure that the English version has worked out all of its bugs and it is what it needs to be, which is why we always ask you, please provide feedback, positive, negative, whatever. Provide it to our email, provide it to your organization who will provide it to us, but don't sit on your hands. If you don't like something, let us know. But the other thing is, for every translation, we have to make sure we meet the data regulations of the countries where that language is spoken. The other complication is, it can be accurately translated, but is it culturally appropriate? And we have to go through and work with consultants and say, does this question in this language resonate with that community? And that's not something that's done automatically. So again, we will have to take the time and resources to get this done right. Okay, and Stella, there is a lot of detail about privacy and security in both the matrix document that popped up in the beginning and RareX. And after the fact, after you've already enrolled, you can always find those at the bottom of the screen, I believe. Okay, great.
Thank you, guys.
It was our pleasure. And I know data is not sexy and fun to hear about. And like I said, first 10 years of my daughter's life, I wasn't really thinking about research. I didn't think it was going to happen in her lifetime. I know now that with the help of organizations like yours, research is moving incredibly fast compared to where it was 15 years ago. And that when organizations like ours take the lead on collecting high quality data, it puts us ahead of those conditions that aren't doing that. And, you know, there's 10,000 rare diseases out there. So we have a lot of, you know, not to say competition, but there's a lot of other diseases in the make. Again, we are rare, but we are not unique. So those standardized surveys that you're answering may lead to research not only for your condition, but for similar conditions that have the same symptoms. And, you know, that would be fantastic. Tom, did I forget anything?
I don't think so. Any other questions from participants?
Nope.
Well,
Thank you guys for doing
congratulations, you
this.
guys. This is super exciting. And I know your time is limited, but as soon as you can get in there, get the account stuff set up and get through the consent and try and at least answer that first survey with the general questions. And if that's all you've got time for, that's great. You'll get some reminders from us. We're not wanting to spam you. So if you don't finish the consent, you might get an email saying, don't forget to come back. If you leave a survey unfinished, you'll get an email. But they're not going to be rolling in every 24 hours. And you know that we don't want you to unsubscribe. So
Awesome. Thank you both. I'm excited to do this with you guys. We're gonna get a lot of data in there.
we look forward to returning the data to you all so you can see it too.
That'll be great.
All right.
Thanks.
Thanks
Tom.
so much.
Thanks, Megan.
Thank you.
Thank you.